2010. My name is Dave Marcotte. I'm a professor of public policy here at UMBC, and I'm pleased to introduce our today, Professor Jens Ludwig. Jens is the McCormick Foundation Professor of Social Service Administration, Law, and Public Policy in the School of Social Service Administration at the University of Chicago and the Harris School at the University of Chicago, and the Director of the Crime Lab at the University of Chicago. Dr. Ludwig's research focuses on some of the most important social problems of our time: urban poverty, housing, education, and crime. But for the past 15 years or so, he has been involved as a PI on the Moving to Opportunity project, which many of you may know is a HUD-funded study to examine the impact of moving people out of low-income housing on a variety of outcomes, including educational outcomes of crime and family formation. And I believe now he is the PI on an extension of that of the MTO study. His work is on important topics is obvious. What may not be obvious to you unless you work in applied social science research is that his contributions to our knowledge are immense and important. And he's widely known and respected and highly influential. Some evidence of this comes from the fact that 2 years ago he won the Kershaw Prize for contributions in public policy research among someone under the age of 40, the most distinguished award for young people in public policy research in the United States. So I'm pleased to welcome today Professor Jens Ludwig.
Thanks, Dave. Great. Thanks so much, everyone, for coming. Can you hear me okay? Great. So Dave promised me that on the on the videotape that they post online, they will make me sound like James Earl Jones and look like either Johnny Depp or Dave Marcotte. So I'm looking forward to seeing that. Thanks so much for coming. This is what I wanted to talk about this afternoon. Is in my normal life, I'm spending the year visiting the Russell Sage Foundation in New York City, but in my normal life, I live on the south side of Chicago. For those of you who have been to Chicago, know that the south and the west sides of Chicago are extremely poor, disadvantaged communities. And what I've been interested in for a long time is trying to understand whether kids growing up in places like the south side of Chicago are essentially doubly disadvantaged. That is, they come from low-income families that can't provide them with all of the opportunities that more affluent families can. I've been interested in the question of whether those kids are doubly disadvantaged by the fact that their communities are also highly economically disadvantaged and distressed, and in many cases, extremely dangerous. And I'm interested in that question in part because public policy has a lot to say about the degree to which poor people in the United States are distributed across geographic space. And so what I'm going to talk about is some background on this general problem, and then talk a little bit about some empirical evidence that I've been working on and a bunch of other people have been trying to generate on this moving to opportunity experiment that Dave referred to. And then I'll conclude with some thoughts about what public policy can do about this. Okay, all right, great. President Obama. So one of the most striking features about Chicago and many American cities is the massive racial and economic segregation of people across neighborhoods, and the incredible segregation of social problems across neighborhoods as well, that are very highly patterned in a very overlapping way with racial and economic concentration. So if you were to stand on, President Obama lives about a half a mile from me in the Hyde Park neighborhood. I was going to show you a picture of President Obama's house here instead of Drexel Foods, but you're no longer allowed to go anywhere near President Obama's house or take a picture of it or even think about it. So if I showed you a picture, I'd have to kill you. But President Obama lives on Hyde Park Boulevard, just a couple blocks away from Cottage Grove Avenue. So Cottage Grove Avenue is on the western boundary of the Hyde Park neighborhood where the University of Chicago is located. And so if you had a strong throwing arm, not me, maybe Dave could do this, you could throw a baseball from President Obama's driveway over Cottage Grove Avenue into the directly adjacent neighborhood of Washington Park. And crossing Cottage Grove Avenue from Hyde Park, you go from Hyde Park into Washington Park, you basically move from one type of world into an almost completely different type of social environment. So in Hyde Park, something like 17%, we pride ourselves on being economically integrated, at least for an American urban community in Hyde Park. We're about 17% poor. Something like 50 to 55% of people living in Washington Park are poor. And I can assure you the other 45% of Washington Park residents are not very far above the poverty line. Hyde Park is nearly 40% African American. Washington Park is fully 98% black. The high school graduation rate at Kenwood Academy in Hyde Park is about 75%. The high school graduation rate at Diet High School in Washington Park, where my 6-year-old daughter takes swim lessons every summer, is not much more, above 1/3. And that's among the kids who actually make it to 9th grade. Despite the compulsory schooling age in Illinois, lots and lots of kids drop out even before they make it to 9th grade. And the homicide rate in Washington Park is something like 25 or 30 times as high as what you see just across Cottage Grove Avenue in Hyde Park. Now, there is a long tradition in the social sciences of concern that the social environment might influence people's life chances, going back at the very least to the Chicago School of Sociology in the 1920s, where sociologists at the University of Chicago conducted a variety of ecological studies noting that social problems like alcoholism, homicide, suicide, poverty, psychosis, and so on, were very concentrated in certain neighborhoods within Chicago, and that these problems were concentrated in these neighborhoods even as so in 1920s, the social problems were concentrated in neighborhoods where different immigrant groups were located. And the social problems were concentrated in the exact same neighborhoods, even though the set of immigrant groups that were in these neighborhoods would churn over time. And so the sociologists in the 1920s were very concerned. They had a big focus on social disorganization and the inability of certain types of neighborhoods to basically informally maintain social control, in part because of this residential churning. The concern was that that made it difficult for neighbors to band together and maintain order. Here's just one quote. The creation of, quote, immoral flats on what was then the suburban fringe of the city were, quote, a very inviting field of commercialized vice, not merely because of the lively and mobile character of these regions, but also because of the anonymity and individuation produced by the highly mechanized living conditions. So the main reason that I like this slide is that we had at the University of Chicago in the 1920s a sociologist looking at risky and delinquent behavior whose last name was Reckless. Okay, so let me back up. Now there are a lot of conceptual reasons. There are dozens, maybe hundreds of social science papers arguing the theory for why neighborhood composition and neighborhood environments might affect behavior. This is a very, very challenging problem to sort out empirically for the following reason. So let's go back to the Hyde Park, Washington Park example. Imagine that we take two observationally equivalent families, both African American, both headed by an unmarried woman with 2 little kids in the family. And one of those observationally equivalent families is living in Hyde Park and the other is living in Washington Park. If we were to look at the outcomes for those kids, we might not be surprised that the schooling outcomes for the kids in the family living in Hyde Park might be at least a little better than what we see for the kids growing up in Washington Park instead, even holding family background constant. And yet we're going to worry that there is still something difficult to measure in our data sets that's different about the mom who somehow managed, either by luck or sheer force of will, to wind up in Hyde Park rather than Washington Park. And so through those sorts of comparisons, we're not going to know, and we're not going to be sure whether the difference in the kids' outcomes across neighborhoods, holding family background constant, is due to the causal effect of the neighborhood environment per se, or instead to something difficult to measure about the family that's associated with the type of neighborhood that they wind up in. And solving this empirical challenge has really been a key focus of the work that I've been on. And this is of much more than just academic interest, because as I said before, public policy plays a very important role in shaping the sort of economic and racial segregation that we see across urban communities. And so just to give you a flavor of sort of the history of Chicago neighborhoods in particular, although you have a lot of this in Baltimore, and we see this in every city across the United States. This is what the south side of Chicago looked like in the mid-1940s. These are vacant lots and tenement buildings. You can see these are not great living conditions. This is a Chicago alleyway in the 1940s. These are some tenement homes in the Italian neighborhood on the west side. There was a lot of concern about inadequate housing conditions, and a lot of concern that a lot of policy concern that the social conditions in these neighborhoods might breed delinquency and other social problems, which gave rise in the 40s, 50s, and 60s to the development of public housing. So I know this is not a Chicago audience, but does anyone here know who this slightly dour, mildly overweight gentleman in the middle here is? This is the first Mayor Daley. So this is Richard J. Daley, who was mayor of Chicago for 20-something years. His son, Richard M. Daley, now has broken his father's record, has been mayor for 22 years. One thing that you can see, this is Mayor Daley and his architects standing in front of a model of public housing in Chicago, which doesn't look so bad in the model, right? And one of the things that you can see in this model is, I'm an economist, not an architect, but I think the French architect Corbusier. I'm not sure if I'm pronouncing that even. My apologies to Corbusier for mangling his name, who had the idea of towers in the park. And so you can see that there's a lot of green space around these high-rise public housings. This was an intentional design feature of the public housing that they talked about building on the west and the south side of Chicago. Can anyone name this Supermax prison? This is actually the Robert Taylor homes on the south side of Chicago. So this is about 2 miles from where I live, or this was about 2 miles from where I live on the south side. This gives you a different vantage point of what the Robert Taylor homes look like. I think at its peak, there were about 50 or 60,000 people who were living in the Robert Taylor homes on the south side of Chicago. This gives you a different view. I just wanted to very quickly, just to give you this is going to be relevant for thinking about the moving to opportunity experiment that I'm talking about in a minute. Most of the families in the moving to opportunity experiment that I was studying came from the Robert Taylor homes at baseline. So let me just spend 1 second talking about a couple features of this slide that are relevant for keeping in mind. The first thing that's relevant for this picture is that it is not an accident that the little kids in this picture are African American. So in Chicago, in the Moving to Opportunity program population in the city of Chicago was almost 100% African American. And the reason for that is that the housing projects on the south and the west sides of Chicago were almost 100% African American for many, many years. The second thing that I just want to point out, for anybody who has little kids, will really find this picture completely heartbreaking to think that there are little kids growing up in conditions like this. The second thing that I wanted to point out about this picture is, I don't know if you can see from where you're sitting, but this is the front door of a Robert Taylor Homes apartment, and this is where normally you would think there would be a window. And I don't know if you can see from where you're sitting, but there's actually plywood over the window. And the reason that there is plywood over the window is because the families are petrified of people breaking into their apartments and doing horrible things. So if you've ever been in one of these Robert Taylor projects, it is bare cinder. It's just a bare cinder wall inside that's very badly lit. You take whatever natural lighting you might have and you eliminate that with plywood over the door. You can imagine this is not great for ventilation in the summer as well. And then there are just bugs in many of the units, and this is just a terrible, this is a terrible environment. The third thing that I want to point out about this picture is they had the idea of developing these open-air breezeways in the Robert Taylor homes, right? So instead of interior hallways to connect the apartments, this is an open-air breezeway. And they had so many problems with people throwing things off over the original railing down onto the public space below that the Chicago Housing Authority had the idea of just putting chain link fencing from floor to ceiling in open-air breezeways. Now, it is true that that is a solution to the problem of people throwing liquor bottles and God knows what else out into the public space, but it also has the consequence of contributing to the supermax aesthetic of the Robert Taylor homes from the inside. So this is basically like the baseline neighborhoods in which the control group families in the Moving to Opportunity study are coming. Okay. Now, at the University of Chicago, there was a revival in interest in neighborhood effects and influences on the life chances of low-income families in the late 1980s when William Julius Wilson wrote a very famous book called The Truly Disadvantaged that made a couple of different points. One of the points that Wilson made in his book is that it wasn't just the development of public housing policies that contributed to the geographic concentration of poor people on the south and west sides of Chicago and in many other cities across the country. But it was also the case, according to Wilson's argument, that the implementation of fair housing laws by President Johnson in the mid-1960s enabled, so it used to be, when we had a lot of racial discrimination in the housing market, it used to be the case that on the south side and the west sides of Chicago, middle-class African-American families were living in the same ghetto neighborhoods with low-income African-American families because they couldn't go anywhere else because of housing discrimination. And Wilson argued in his book that the fair housing laws and the other civil rights legislation of the 1960s had the unintended consequence of enabling middle-class African-American families to move out of places like the south side and the west side of Chicago, which contributed to the increased concentration of poor families in highly disadvantaged neighborhoods. And Wilson argued that in addition to the problems that the sociologists of the 1920s thought would come from concentrated disadvantage, Wilson argued that this further disadvantages people growing up in these neighborhoods by depriving them of middle-class role models that demonstrate the value of schooling and working in the formal labor market, and also changes the sort of peer influences that operate on people living in these communities. I should also say, please feel free to stop and interrupt me anytime with questions or comments or anything. This is this picture just gives you a flavor of what Wilson was talking about in terms of the changes in the number of people living in high poverty neighborhoods, that is census tracts with 40% or more poor, and the number of actual census tracts that are 40% or more poor over time. You can see there was a big increase from the 70s through the 1990s. There's been something of a decrease from 1990 to 2000. I'm not exactly sure. Next week, I guess we'll see, or maybe sometime this week, the census is going to release new census tract data that will show us what's happened over the 2000s. But even with the dip in concentrated poverty between 1990 and 2000, you can see there are still a lot more people living in high poverty urban neighborhoods in the United States than there were in 1970. Okay, just to give you some sense for the scale of the problem. Now, the story that I want to tell about moving to opportunity really begins in the late 1960s with a very inspirational public housing resident named Dorothy Cottrell, who was an African-American woman living in a public housing project on Chicago's South Side, who filed a lawsuit against the Chicago Housing Authority and the U.S. Department of Housing and Urban Development. Dorothy Cottrell looked around her housing project and said, why is it the case that our housing projects in the worst neighborhoods in Chicago are entirely African-American, and all the white people in Chicago who get housing assistance live in much less crummy neighborhoods, right? And so she filed lawsuit together with a nonprofit group in Chicago that made its way up to the US Supreme Court, and in 1976, the US Supreme Court said Dorothy Cottrell is right, and ordered the Chicago Housing Authority to relocate 7,000 African-American families from public housing to other parts of the city of Chicago or to the suburbs. Now, my friend Jim Rosenbaum is a sociologist at Northwestern, and starting in the late 1980s had the idea to follow what had happened to the public housing families who had been relocated as a result of the Cottrell program. And there was no control group in the Cottrell program. So basically what Jim was doing is he was looking at the outcomes of public housing families who moved to other neighborhoods in Chicago and compared them to what happened to public housing families who were relocated to the suburbs of Chicago. See, these are places like Oak Park. For those of you who are Ernest Hemingway fans, Hemingway grew up there. There are a lot of fancy Frank Lloyd Wright homes. It's a very affluent suburb. So this is a very large difference in neighborhood environments for people who are moving to other parts of Chicago versus places like Oak Park. If you look at the racial composition of the suburban versus city movers in Cottrell, you look at the poverty composition of the neighborhoods in which people are living, there are massive, massive differences. And what Jim found when he compared the suburban movers in Cottrell to the city movers in Cottrell was that the kids who moved to the suburbs had dramatically better schooling outcomes compared to the kids who moved to the city in Cottrell. And the parents who moved to the suburbs in Cottrell had much better labor market outcomes than the parents who moved to other parts of the city through the Cottrell program. Now, Jim and many other people interpreted these Cottrell results as evidence confirming the long-standing hypothesis that neighborhood environments themselves had extremely powerful causal influences on people's life chances. The problem with Cottrell is that it was not set up as a real randomized clinical trial like we have in medicine. A lot of the people who were offered vouchers, didn't take up the voucher offer, and a lot of the people who moved to the suburbs wound up moving again. And so Jim goes out and does a survey of people. So Jim did the best study that you could possibly imagine under the circumstances. This is not a critique of the great work that Jim Rosenbaum has done. But when we go out and look 10, 12 years out after people move, and we look at the people who are still in the suburbs, and we compare them to the people who are still in the city, we have lingering concern that the type of people who agreed to go to the suburbs are different from the type of people who agreed to go to other parts of the city of Chicago, and the type of person who stayed in the suburb is self-selected as well. That is to say, we don't know from that suburb-city comparison in Cottrell, we can't be sure that the differences we see are due to the causal effect of living in the suburbs versus the city versus unobserved differences of the type of person who winds up in the suburb. Okay. However, Jim's Cottrell study had an incredibly powerful effect on people who were running HUD at the time. So Jack Kemp was HUD secretary at the time under the first Bush administration. And he was very much a free market proponent and loved the idea. He loved the Cottrell findings because it suggested the possibility of basically outsourcing public housing to the private housing market. And under Jack Kemp, HUD started discussion of doing a real randomized experiment, which would eventually become Moving to Opportunity, in order to rigorously and definitively test this hypothesis that neighborhood environments matter a lot for people's life outcomes, building on Cottrell. So 1992, as a result of George Bush, in part as a result of George Bush's Read My Lips, No New Taxes pledge, he loses to Clinton. The Clinton folks come in, they take over HUD. They love the idea of Cottrell and doing Moving Opportunity, not necessarily because they love the idea of outsourcing public housing to the private housing market. What they like about Cottrell and the idea of doing the Moving to Opportunity experiment is the possibility of reducing the concentration of poor people. That is, spreading poor people out into more integrated neighborhood and community settings. And so under the Clinton administration, HUD funded the first real randomized experiment to test this hypothesis that neighborhood influences affect people's life outcomes, called moving opportunity. So starting in 1994, under MTO, about 4,600 public housing families were enrolled in, they were enrolled in MTO in 5 cities. Baltimore was one of the sites, Boston, Chicago, LA, and New York. Around 2/3 of the families were African American, 1/3 were Hispanic. In Chicago and Baltimore, the program populations were entirely African American, and in the other 3 sites, they were more evenly mixed between African American and Hispanic families. That's just an artifact of who was living in the baseline housing project. So when MTO was on the design board, education researchers were saying people are going to love MTO. They're going to sign up for it because they want to get access to better schools. Economists were arguing, no, people are going to sign up for MTO because they're going to want to have access to better job opportunities. Health researchers were saying the real reason people are going to want to sign up for MTO is access to better healthcare facilities. And the housing people were saying, no, the real reason you'd want to be an MTO is better housing. At baseline, HUD did surveys of these families and found that 3/4 of the families said the first or second most important reason they signed up for MTO was safety and crime, getting away from the crime in these baseline housing projects. And one of the most shocking statistics on these baseline surveys is one of the questions was to the moms signing up in MTO. They were asked, has anyone in your household been the victim of a crime over the last 6 months, 6-month period? Half of the moms said yes. Imagine, again, anybody with kids will find this absolutely heartbreaking. Imagine that you were trying to raise your kids. So one of the eligibility criteria was you had to be in one of these baseline housing projects and you had to have kids. Imagine trying to raise your kids in an environment in which the 6-month crime victimization rate is 50%, right? Okay, so these families, they sign up for MTO and then they are offered the chance to use a housing voucher to move to a lower poverty neighborhood. So the way this worked, there are actually 2 different treatment arms if you would use the clinical trial language from medicine. But I'm going to focus on the treatment arm where they gave families housing vouchers that could only be redeemed in census tracts. So a census tract is an area defined by the census that contains about 5,000 to 8,000 people. I'm going to focus on people in what we call the low poverty voucher group. They were given a voucher that they could only use in a census tract that had a 1990 poverty rate below 10%. So the baseline neighborhoods had an average poverty rate of something like 60%, right? So this is basically moving from one end of the neighborhood poverty distribution in the United States to the other end of the distribution. This is a massive change in social environment by the standards of social experiments in the United States. Okay? And it was randomized. The randomization was done by Apt Associates, a well-regarded private firm in Cambridge, Massachusetts. So randomization was actually done well. You can look at the baseline characteristics of the control families, and they look identical to what you see in the, for the families offered the low poverty vouchers. So I was a junior member of the team that followed the MTO families up about 5 years after random assignment. And so this slide gives you some sense for the change in the neighborhood environment. So the blue bars here are the average neighborhood characteristics for the families who move with one of these low poverty vouchers. And then the darker bar is the average for the control group measured 5 years after random assignment. Okay? And what you can see is that the average poverty rate 5 years after random assignment for the control group is about 40%. So the control group's poverty rate has come down a little bit since baseline because poverty rates in general, neighborhood poverty rates in general, have been declining over this time. Moving with one of these MTO vouchers basically cuts your neighborhood poverty rate nearly in half. Okay? Now, there is almost no community level intervention that I can think of that would have such dramatic changes on someone's community environment as to cut their neighborhood poverty rate in half. So this is a huge change in the neighborhood environment that people are experiencing, at least with respect to poverty. What was interesting, when I first started to get involved with MTO, I had imagined that people were going to move to, maybe I'm just dating myself by this next reference, but people were going to move to places like Mayberry. Does anyone, nobody gets that reference, do they? So Mayberry was, so one guy in the back raised his hand, thank you. So Mayberry was this all-white suburban or rural town that had low poverty rates, right? In fact, what MTO families did is they basically moved next to the Huxtables. Do people get that reference, or have I just dated myself again? You can see there were very large changes in neighborhood poverty rates, very modest changes in neighborhood minority composition. Okay? The next set of bars here show the crime victimization rate. And so MTO basically, we had a massive crime drop over the 1990s, right? And so the crime victimization rates have declined a lot since baseline as well for the control group. But moving with one of these vouchers cuts your risk of crime, your household risk of crime victimization over the last 6 months by about 1/3. That's one way to think about it, which is a really, really big change. And you can see in the final two bars, families are just way happier with their neighborhoods when they get one of these low poverty vouchers, right? So something happened as a result of these random assignments. These were dramatic changes in the neighborhood environments and people in which people were living. Now, there are shelffuls of social science research scattered around this library that would claim that the sort of neighborhood changes that we observe in MTO through 5 years out should have profound, almost miraculous changes in people's life outcomes. Okay, so you might want to sit down for what's going to come next. The actual pattern is much more complicated. The actual pattern of impacts of MTO on people's life outcomes is actually much more complicated than anybody that I know had been predicting in advance of the start of MTO. So the first set of bars shows you the likelihood that you were unemployed or on welfare. Basically, no statistically significant difference between the control group and the MTO movers. Now, there were very important changes on the health dimension for MTO families. Maybe not surprising, given that crime and the fear of crime was one of the major reasons that families wanted to sign up for the program. Very large changes in depression. So the way it's scaled, you probably can't tell how important that effect is, but Jeff Liebman at Interim did a calculation that showed that the MTO effect on depression measured 5 years after baseline is about as large as what you get out of best practice drug treatment for depression. So MTO is like Prozac for these families. There's no change in self-reported health at 5 years out, but very large changes in the likelihood that the women in these families, that is the heads of household, almost all of these families were headed by a woman, very large declines in the likelihood of obesity, defined as having a body mass index of 30 or higher, right? So important changes on the health dimension, no change in any sort of economic measures. So we've looked at like 5 bazillion other measures of employment and hourly wages and so on, and there's just no sign of an impact anywhere. Here's what we saw for the kids. So you might think to yourself, well, maybe the parents their employment outcomes wouldn't change because they've already been socialized in these high poverty baseline neighborhoods, and their sort of preferences and senses of themselves and styles of behavior are just fixed. You might think that the kids who are more developmentally plastic might be more responsive to the change in these neighborhood environments induced by MTO. Now, what we saw in MTO is very large changes in the likelihood that kids are arrested for a violent crime. So if you compare the MTO movers, they are much less likely to be arrested for a violent crime than the kids assigned into the control group. But the boys in particular in the MTO mover groups are much more likely to be arrested for a property crime when they move to the lower poverty neighborhoods. Now, if you've ever been to a place like the Robert Taylor homes, your immediate reaction will be, this is probably not surprising because there is nothing that you would want to steal in the Robert Taylor homes. No effect on drug arrests and other lifetime arrests. If we look at survey data for a variety of different risky behaviors. The general pattern, aside from violent crime, the general pattern that we saw 5 years out is that aside from violent crime, boys who move to lower poverty neighborhoods seem to do worse on almost every other dimension of risky or delinquent behavior compared to the boys who were in the control group, while girls did almost better on every dimension, including violent crime. So violent crime, boys and girls do much better when they move to lower poverty neighborhoods. And on everything else, girls do better when they move, boys do worse. Yes?
I'm curious, what was the average age of the children who moved? Because I would think that age could have like an effect on it.
Yeah, it is that is a great, so these are results looking at kids 15 to 20 years old, 5 years out. So these were kids who are about 10 to 15. Now, ideally, what we would like to do is to know whether there is variation by age at baseline. The challenge, the inferential challenge for these analyses is that kids don't start to get arrested until they start to reach like age 13 or 14. And so the kids who are like much younger than 10 at baseline were too young at the 5-year follow-up to really start getting arrested. And so we don't know. Now, however, we did collect test score information. So you can look at test scores for kids who are younger than like 15. And when you look at kids who are ages 6 to 20 at the time of the 5-year follow-up, there were absolutely no signs of changes in reading or math scores between the MTO movers and the control group. And so your question is great. We had exactly the same question when we were analyzing the data, and we redid the analysis thinking that the kids who were relatively younger at baseline might show more pronounced evidence of an increase in test scores, and we found absolutely no indication that that's true. Now, we're currently doing the long-term follow-up, and in principle, that might show a different picture, but at least through 5 years, kids who were 6, 7 years old at baseline don't look any different with respect to the treatment control difference in test scores than kids who are like 10, 11, 12, which is surprising because my intuition is just like yours. I would have expected that the younger kids really would have shown much more of a benefit on their academic outcomes. It's a real surprise. OK, so I think I've got 2 more slides that I want to talk about, and then I'll stop and I'll take your questions. So let me just spend a couple minutes talking through some, what I think of are the lessons from the MTO findings so far for urban policy. So one sobering effect that working on MTO has had on me is that I have become much more skeptical about the ability of social science theory or common sense to predict the way the world really works. I never would have expected the pattern of results that we saw at the 5-year study. I wouldn't have expected big differences between violent crime and almost every other behavior for boys. I would not have expected these dramatic changes in these dramatic gender differences and how kids respond to moving to lower poverty neighborhoods. Dave and I were talking before, if MTO were not a randomized experiment, nobody in this room would believe that those findings were real because they would be so counterintuitive, right? I wouldn't believe in myself either. So that's one thing. In terms of the substance of the MTO findings, we see important changes in health and delinquency, no changes in labor market outcomes or schooling outcomes. This is a much more mixed pattern of findings than the social science theoretical literature would have predicted and what the non-experimental literature would have predicted. What's interesting is that when we dig deeper into the health impacts in the 5-year study, they seem to be driven. So there's a lot of concern about inequality across neighborhoods and access to healthcare resources. To the extent to which we see changes in things like depression and obesity and diet and exercise, the health changes that we see in MTO seem to be driven by changes in the health behaviors of the moms in these families, rather than changes in access to or utilization of medical treatment, which I think is interesting and also not obvious in advance, right? And the other thing that we see when we look at the MTO data and try and understand what the mechanisms are behind these effects is if you think about what the MTO study is doing, it's really changing 2 different types of things for families. They are not only changing neighborhoods, but they're also changing their housing units, right? They're moving from a Robert Taylor home apartment with bare cinder blocks, badly lit, bugs everywhere, and plywood over the window into a not great, but much better private, usually much better private market apartment. We can see big changes in housing unit quality in all the survey data that we've collected. We can talk about how we figured this out during the Q&A, but we've done some analyses that suggest that to the extent to which we see MTO impacts on delinquency and health outcomes, that seems to be driven almost entirely by changing the neighborhood environment of families, not by changing their housing units, which is interesting. Now, that last point is very interesting because, at least in the housing research and the social science studies that I've seen, it appears to be the case that it is very difficult to get families to move into substantially different types of neighborhoods. Now, what MTO and some other housing voucher studies have shown is that public housing families will move to different types of families when you give them a housing voucher, right? That's not surprising because there's a long wait list for public housing in Chicago and most other places because families are so desperate for housing subsidies. Public housing gives you basically a take it or leave it offer, right? You take it and you move to the neighborhood that they give you and the housing unit that they give you. And when you give families the chance to get a unit subsidy, but now they can pick the neighborhood, you're not surprised that families are going to, what economists would call, re-optimize and move to a neighborhood that they would actually like to live in, or at least a neighborhood that they would like to live in and they can find a landlord that will lease to them with the housing voucher. If you look at families who are already living in private market housing, however, right? So when you look at families who are not getting any sort of housing subsidy and already living unsubsidized in the private housing market, when you give those types of families housing vouchers, they move to better housing units, but they don't change neighborhood types. So there's almost no effect. So there are huge changes in rent. So Brian Jacob and I are doing a study of families in Chicago, so this, where unsubsidized families get housing vouchers. They experience something like a 50% increase in rent as a result of the housing vouchers. So they spend like $6,000 a year on housing at baseline. They get a voucher. They spend like $9,000 a year on baseline. The way economists normally think about housing, we think that housing unit quality is a normal good, that is, you buy more of it when you get more income. And we think that neighborhood, quote, quality is a normal good, that you buy more of it when you get more income. And families do not seem to be spending almost any of this housing voucher on improved neighborhood quality, okay? My personal hypothesis about this, and I don't think that we really know the answer to this, but I think one important explanation, potential explanation for this is what economists would call path dependence in residential location as a result of social networks. So you grow up in a neighborhood, you go to church, you have friends, and now you're given the opportunity to relocate. Moving is very costly. So anyone who has been forced with the choice of moving for a better job or any other reason will recognize that moving away from family and friends is usually, not always, but usually a big cost, depending on who your family and friends are. Okay, so let me close with some thinking out loud thoughts about the potential implications of these moving to opportunity findings for urban policy in the United States, which is to wonder whether it makes sense to think about getting rid of low-income housing programs altogether. So the federal government currently spends, you can go to the Green Book that the House Ways and Means Committee puts together every year, and you can see that, that HUD and USDA together, I think, spend around $40 billion per year on means-tested housing programs. That is, housing programs to help low-income families improve their housing conditions. There is no empirical evidence yet, convincing evidence that I have seen, to suggest that housing unit quality really does very much to improve the long-term life chances, or even necessarily the measures of happiness and life satisfaction for low-income families. You might object to this proposal and say, it is outrageous to think that we would end housing programs and force low-income families to live in substandard housing units. Public policy clearly does not share the view that it is unacceptable for poor families to not have subsidies for their housing units, because our current housing policies are completely insane right now. We give the average housing subsidy for families who get housing subsidies cost something on the order of $6,000 to $7,000 to $8,000 a year, depending on which city you're looking at. They're incredibly expensive, and we give them to only about 28% of income-eligible families. So 28% of poor families in the United States get this massive windfall and experience a huge change in housing consumption. And because now they're also able to reduce their out-of-pocket spending on housing from the voucher, they can buy lots more of other stuff as well. But that doesn't do anything to improve the long-term life outcomes of their kids, right? So this is $40 billion that's not doing anything, as far as I can tell, to reduce the intergenerational transmission of poverty from one generation to the next. Imagine that instead we ended low-income housing policies in the United States. Imagine what we could do instead with that $40 billion. One way to think about this is the United States right now. So it's hard to think about these numbers because Obama just cut a tax deal for $990 billion. So $40 billion seems like a rounding error that's not even worth thinking about. But let us stipulate for the moment that $40 billion seems like a lot of money. It is a lot of money by the standards of social programs to help poor families in the United States. We spend about $8 billion a year on Head Start right now. Early Head Start is the Head Start for Head Start. This serves kids who are 1 to up to age 4, 3 or 4. That gets less than $1 billion a year. $40 billion a year would support a massive expansion in early childhood interventions in the United States. I've done a paper with Bell Sawhill at Brookings, and we think that for something like $40 or $50 billion a year, we might be able to come close to eliminating the black-white test score gap in the United States. That is the disparity in achievement test scores between black kids and white kids. Here's another way to think about what you could do with $40 billion instead. We spend about $100 billion a year on policing in the United States. From having done some research on policing myself, I think that we are way under-policed right now. Every dollar that we put into putting more cops on the street, my calculations with John Donahue suggest generates something like $4 to $8 in benefits to society in exchange, right? Which would make you think that we should really ramp up our investments in policing protection. That would be very consistent with the fact that the MTO families themselves are telling you that their #1 priority is safety. $40 billion would support a massive proportional increase in policing protection. And all of that, in principle at least, could be concentrated in the most disadvantaged neighborhoods, right? And so when I am looking at the MTO results and I'm thinking about the opportunity cost of the $40 billion, I am left wondering whether it is possible that there is a budget-neutral way to substantially improve the life outcomes for low-income families through resource reallocation from housing programs to things like educational interventions or public safety. So there are probably going to be a lot of people who want to yell at me for this proposal. So let me just stop there and take questions, comments on any parts of the talk. Yes.
I was wondering if there's any findings or evidence about the families that or the participants in the MTO program that moved back to a similar cultural setting or neighborhood that they came from because of the feeling more comfortable in that setting, or is that?
Yeah, that's a very good question. The great strength of MTO is that it's like a clinical trial, right? And so if you think of a clinical trial, you've got all the people who are offered Lipitor, which is I think some sort of cholesterol drug, and then you've got all the people who are given the sugar pill instead. And the strength of the randomized clinical trial is that you can be sure that the gets offered the Lipitor group is the same as, on average, would have the same health outcomes as the gets the sugar pill group if you gave everybody a sugar pill. Within the group of people who are offered Lipitor, some people are not going to abide by their Lipitor treatment because they don't like the side effects. That is a self-selected subgroup of people within the Lipitor group. The analogy in MTO is that families get these housing vouchers, and only about half of them who are offered the vouchers to move to the low-poverty neighborhoods actually wind up moving. And among the families who move to, so the way MTO works is you have to go to a neighborhood with less than a 10% poverty rate and stay there for a year in order to redeem the voucher. But once the year is up, you're allowed to use the voucher to move again, right? And so some families actually did that for the same reason that families in public housing, once that constraint is lifted, decide to re-optimize. Families who are constrained to live in low poverty neighborhoods, you lift that constraint after a year, many choose to move again. Unfortunately, we can't do a great job of teasing out the effects on the people who move, because that's a self-selected subgroup of the treatment group within MTO. It would be like comparing the people who stay on Lipitor in the Lipitor group and comparing them to the people who after a year think, this Lipitor is a drag, it gives me headaches or whatever it is, and I'm just going to stop taking it. So we wish that we could learn more about that. Yeah.
Did you factor in the issue of distance? I'm going back to your initial picture, was two neighborhoods, very different, but very close together. So if you make the move you could make a move to a lower poverty area that is very, very close. In other words, social networks could still be sustained, behavioral modes could still be sustained. I'm just wondering if you factored in kind of space-time difference. If you move to an equally low, but it's much further away, essentially cut ties.
No, that's a great question. So I'm spending the year at Russell Sage, and Rob Sampson, the sociologist at Harvard, is in the office next to mine. And he has a doctoral student who's reanalyzing the MTO data and has done some quasi-experimental analyses to try and... Now, it's a little bit tricky because the way that she's analyzing the data is not completely experimental. So you would want to keep that qualifier in mind. This goes back to the same point that we just talked about. But with that caveat in mind, it looks to be the case that some of the health impacts in MTO on the moms, she's focusing on that outcome. Those outcomes seem to be larger in areas where the moms make the longest distance moves. So that would be some evidence for your hypothesis. Yeah. Yes?
So it never occurred to you before you started the study that you could take the boy out of the hood, but you couldn't take the hood out of the boy?
So here's...
moving them to nicer neighborhoods or next to the Huxtables, that they'd see that the Huxtables had nicer things and start stealing from them?
So here's, if you look at the theoretical literature on neighborhood effects, so I appreciate the snarky question. If you look at the theoretical literature on neighborhood effects, there's a lot of writing that says that moving to a low-income neighborhood may well have adverse effects on people because of this change in perceived relative position. I will bet anyone in this room $50. I will give anyone in this room $50. I'll give anyone in this room $100. If you can show me an example of a theoretical paper prior to MTO that gives a reason why you would expect that to be so different by gender, right? Once you see the results after the fact, you think, of course, you idiot. Why wouldn't you think that the boys and the girls would respond differently? But it's the gender difference that's so surprising. If the girls had the exact same outcomes as the boys, you would think, of course, right? But it's the fact that the boys and the girls respond so differently that I think is the real surprise, at least for me. To grow, yeah, we do not have great measures of access to food resources. What we can do is we can look at something, so if you imagine the logic chain, the logic model I think that you have in your head is changes in access to grocery stores, change diet, changes obesity. And we don't have great measures of access to the grocery stores, but we do have measures of diet. They're not great measures of diet. We had 75 minutes to talk to the moms. and 500 minutes worth of stuff to ask them, and so we had to be very, very selective in what we could ask. But there's some suggestive evidence at the 5-year follow-up that frequency of doing things like eating fruits and vegetables went up for the moms. So that would be consistent with a change in access to grocery stores, although it would also be consistent with a change in local social norms or information or whatever else about, and it also gets at the question of what we mean by access. So I think if you read the food desert literature, the thing that a lot of people have in mind is that there's no Whole Foods on the south side of Chicago, which there isn't, right? But a different way in which MTO could have changed access is by helping families move to much safer neighborhoods where they just might be more willing to go out and shop, right? And that's not nothing, right? If you think about the role that crime is playing in the lives of these families, I think it is very possible that changes in safety might be very important for mediating a lot of the behavioral changes and outcomes that we see here. Yeah.
Along those same lines, socially, how many getting women are in the neighborhoods that they moved to that these women are now comparing themselves with? I mean, to go back to the Huxtables, you just moved next to Claire Huxtable. You're competing with her. You're seeing her as a role model.
Yeah, it's hard to know how to it's hard to know how to think about that. Like I used to go to the gym when Arnie Duncan lived in Hyde Park. I would go to the University of Chicago gym and I would see Arnie Duncan working out like a maniac. He was a professional basketball player in Australia after he was like the leading scorer at Harvard, and he's like 100 times more athletic and taller than me, and he'd work out like a maniac. And my reaction was, I should just give up. So it's hard to know how that one would cut. And again,
you're not a woman.
Well, I appreciate that. Thank you. Yes, in the back.
I'd like to know, hear you talk a little bit about how you measure the schooling outcomes.
Yep.
And have a little dialogue about that.
Yeah, so that's a great question. So we measure schooling outcomes in a variety of different ways. So one thing that we do is we ask the kids to self-report their grades in school. And that's not going to be very satisfying because you might think that the grading standards are very different across schools. So when I tell you that there's no effect on self-reported grades, you're not going to know what that means. A different thing that we can do is we ask the kids and the moms to tell us something about the types of courses that the kids are taking. So are the kids actually being engaged with a more rigorous curriculum? And we didn't see much evidence of changes in I'm going to say improved course taking, but you know what I mean. The third thing that we did is we got student level school records for the kids so that we could take advantage of the standardized achievement tests that the schools are administering. And those aren't perfect because we've got a national sample, and the kids are moving out of the MTO cities into the suburbs, and they're using different tests and they're testing different grades, and so there's some noisiness in using the standardized tests that the schools give. But we don't see changes across the 5 sites in achievement test scores that the schools administer. We don't see changes in self-reported dropout rates or administratively reported dropout rates from the school records. And the final thing that we did is we administered kids the Woodcock-Johnson test. So this is a widely used, so this is an adaptive test where they give kids these tests that sort of select the types of questions that they get based on their prior responses to try and maximize the amount of information that you get about the kid's achievement level for a given number of questions that you can ask the kid, because we have limited amount of time to spend with them. And lots and lots of studies use the Woodcock-Johnson. Jeannie Brooks-Gunn was one of the people for the interim MTO study. She's a psychologist at Columbia. She was the one who recommended the Woodcock-Johnson. Those tests are also not perfect because we see some evidence of that would be consistent with, I guess, a ceiling effect on the Woodcock-Johnson, in that if you look at kids who are like age 12 to 20 at the time of the 5-year follow-up, there's not that much difference in the average Woodcock-Johnson reading and math scores of the 12-year-olds versus the 13-year-olds versus the 14-year-olds versus the 15-year-olds versus the 16-year-olds. We would hope that kids would learn more as they progress through school, and so we would hope that an achievement assessment would show a steadily increasing age gradient in achievement, and that's not what we saw for the Woodcock-Johnson up through age 12. For the long-term MTO study that we're just wrapping up now, we worked with Don Rock at ETS and used the tests developed for the Eccles-K, the Early Childhood Longitudinal Study kindergarten cohort of 1988, which Don Rock argued is much more closely tied to the curriculum that kids should be exposed to at school. And we did a variety of things. We drew in some questions from the NELS, which is a high school study, to try and minimize the risk of ceiling effects with that test instrument. Does that help?
Yes, and the kids that you have the school data on are kids that stayed in the program for a length of time, or?
No, we always try and collect data for everyone who is in the baseline study sample. So we obviously don't want our findings to be artifacts of selective attrition across MTO groups. So the effective response rate for the long-term, for the interim MTO study, so the 5-year study that I'm talking about here, was between 88 and 90%. So of everybody who started the study, we got survey data for basically 88 to 90%. And I was responsible for getting the the arrest data, and the administrative data response rate was something like 95% for that. So there's not a whole lot of room. So by social science standards, these are really good response rates. And the non-responders look very similar to the responders with respect to their baseline characteristics. So it doesn't look like selective attrition is much of an issue. Yes?
Yeah, I'm kind of surprised that I didn't hear you talk anything about family configuration, you know, going back to Harvard and Moynihan's studies and what he saw. But you didn't look at changing family configurations when they move out of neighborhoods, if there was any, and if that might have had any effect.
Yeah, that's a good. We haven't seen. Let me give you a two-part answer to this. So. MTO is a study that compares living in public housing to getting a housing voucher. And in MTO, we have not seen any change in family composition. HUD funded a different voucher study called Welfare to Work, where they gave housing vouchers to families who were not getting subsidized. And what HUD found, I think APT did the evaluation after MDRC did that study. And what they found in the Welfare to Work study is that giving a housing voucher to an unsubsidized household reduces family size, right? And the hypothesis that the APT researchers had was that it provides women with enough resources that they can basically afford to ditch a husband or a cohabitor that they are not happy with for whatever reason and live on their own. Right? And I'm not taking a normative stand about what the right family configuration is, but that seems to be, and I'm not necessarily taking a stand on that being the correct interpretation, but the fact that they found is that family size goes down primarily by this reduction in adult men in the home, and then there's a conjecture about what the mechanism might be. But we didn't see that in MTO. Yeah, in the back? That's the national number. That's the national number, yeah. Yeah, it's so shocking you can't believe that it would be true for the United States. It's so shocking to me, right? Because it's so antithetical to every other social program that we run. Imagine taking the food stamp program that we have right now and saying, I've got a great idea. Let's restructure the food stamp program to be like the housing voucher program, where we're going to give 3 times as much food stamps to 1/3 as many people, right? The public would understandably go completely ballistic. It doesn't make any sense to me.
It makes more sense. Like, the only way I could wrap my mind around it was the wait lists, analyzing the wait lists, especially here in Baltimore. They closed one, and I think Section 8 is still open, but it's an 11-year wait for new families.
The fact that it's an 11, so the fact that we have these long wait lists provides a research opportunity to social scientists. But what it tells you is that the reason that we give it to just 28% is not because the other 72% don't want it, right? It is an intentional policy decision to give windfall housing subsidies to just a small subset of all low-income families. Yeah.
What does that look like? What does the 28% look like in terms of race and, I guess, poverty level?
Oh, you're not allowed. So the one ground rule was you're not allowed to ask me tough questions that I can't answer. So I actually don't know the answer to that. That's a very, very good question. We'll just edit this part out afterwards. Great. I got the thumbs up from the tech guy. That's terrific. Yeah, in the back.
Okay. When you were saying at the very end, the solution is to shift money from the housing to education and public safety. It seems like in Baltimore City, in the 90s, with all the influx of all the upper, young urban people who come live there, public safety has been improved for them to live there, and education also has been improved. So I wonder if that has then, on the reverse side, instead of moving lower economic out, you're bringing in higher economic.
Yeah, let me tell you my perspective on Baltimore. So I live in Chicago. What do I know, right? But let me tell you my perspective on Baltimore and what you just said, which is arguably the number one policy issue in Chicago right now is youth violence. We've had something like 600 or 700 Chicago public school kids shot over the last 2.5 years, something like that. Those numbers are order of magnitude, right? This is the huge issue that the philanthropic community and city government is worried about. This is the number one issue in the city of Chicago, where our homicide rate is 15 or 16 per 100,000 was the last set of numbers that I saw. We're freaked out in Chicago about lethal violence, in part because it's a horrible problem, and in part because cities like New York have homicide rates of 6 per 100,000. We look at New York and say, how come New York has a homicide rate that is nearly, around a third of ours? Why can't we do that? Baltimore's homicide rate, the last time I checked, is usually tends to be on the order of 30 to 35 per 100,000. You guys are like Detroit, right? And so it is possible that the influx of yuppies into Baltimore is making the crime problem a little less bad in Baltimore, but it is really bad. It is really, really bad, right? And another way to think about this is that if you go to the national vital statistics data and you look at causes of death for 15 to 24-year-old African Americans in the United States. So take black 15 to 24-year-olds in particular. Not only is homicide the leading cause of death for black males 15 to 24, homicide is responsible for more deaths than the 9 other leading causes combined, right? This is a huge, huge first-order social problem that we are not doing nearly enough about. And it is great that yuppies are moving into downtown Baltimore and helping rebuild the tax base, but Baltimore is a long, long way from having this problem solved, as is Chicago, I should say. So, yes. Oh, sorry, how are we doing on time, Dave? One more question? Okay, last question. And
I have a couple of questions. So my first question was like, what are the hypotheses for your future outcomes? And like, of course, taking into account family history, how is your proposal going to help with building diversity? And I feel like poverty rates will still remain the same since there'll be no job opportunities coming in because you're staying in the same community. You're just like making it safer and helping with education, which seems like very similar to the MTO research and what they did. So how is that going to help with diversifying the community?
yeah, let me.
Can I add on to this? Can you give us some sense of what you think you might be finding in follow-ups that you didn't tell us about tonight?
So the long-term MTO results are embargoed. So if I told you, I'd have to kill you. And since all of this is on videotape, Dave said it's Baltimore, so it's fine. That's great. Would barely register in the city's homicide statistics. What a cheering thought from the audience. So I'm going to defer the question. I'll say no, you'll have to invite me back. That's okay. But let me just say a little bit about this question. I was at a Hamilton Project event that the Brookings Institution organized maybe a month or two ago, and Governor Granholm from Michigan was telling a story about trying to keep a vacuum cleaner factory or something from leaving Michigan, and they offered the company tons and tons of tax breaks to stay in the United States. And the head of the company turned to her at the end of the negotiations and said, look, you can't give me enough tax breaks to compensate for the fact that there are people in Mexico who will work for $1 an hour, or China for 50 cents an hour, something like that, right? The way that we are going to keep, so Germany, on the other hand, does a lot of manufacturing. Why does Germany manage to do a lot of manufacturing? Because they do a lot of high-skilled manufacturing, right? One way, so the way that you keep companies, I think, is either that you have people who work for free, and I don't think there's going to be a lot of support for lowering the minimum wage in the United States to 50 cents to compete with China, right? Or you try and have a highly skilled workforce. If you spend $40 billion a year on, so Bell Sawhill and I did a calculation where in North Carolina they did something called abecedarian, where they took kids from low-income families and they gave them year-round, full-day, very intensive, very high-quality early childhood education from 6 months up through age 5. And that had profound effects on achievement test scores that faded out a little bit over time, but profound effects on the likelihood of being poor when you grow up, the likelihood of, and every bad outcome that you could think of went down and every good outcome went up. We estimate that for a total of about $50 billion a year. So if you took Head Start funding and you added that to the $40 billion from housing programs, I think that you could give every poor kid in the United States something like that. I think that it might not literally reduce the black-white test score gap, but it would fundamentally change inequality in the United States, and it would fundamentally change the global competitiveness of the United States in the sense that you have a bunch of people now who are graduating from high school. The dropout rate in Chicago is 50% right now, right? How are dropouts in Chicago going to compete with people in Mexico who are working for $1 an hour, people in China who are working for 50 cents an hour? This, moving the money to early childhood education would fundamentally change that equation. Putting the money into policing will keep businesses from moving out of Chicago. Every homicide, and people, and taxpayers as well. So this gets back to the Baltimore point. Every homicide that happens in Chicago, so Steve Levitt has done a study, every homicide that happens in a city drives 70 people out. Now imagine that you're the mayor of Baltimore and Chicago and you're trying to maintain a city and a tax base to have adequate resources for the schools and every other social service. Every time someone gets shot and killed, you've just lost 70 residents, presumably most of whom will be taxpayers, right? So, so that is sort of the long term. I think putting the money into housing is not doing anything to address these long-term challenges. My specific proposals might not be the right one, but I think it is worth thinking harder about whether there are better ways of using $40 billion a year to address these really important social problems over the long term. So let me stop there, and thanks everybody for coming.
I want to say two things. One is that we have refreshments. I invite everyone to come back and talk informally with Professor Ludwig and talk about what we learned today. And secondly, I want to thank very much Professor Ludwig for a great talk.
Thanks, Dave.